Hi, I'm Steph Edwards. I'm a doctor and I specialise in histopathology, which is using cells to study and diagnose diseases.
Oh, thank you. How are cells relevant to your work?
My work is pretty much entirely all about cells. What we do as histopathologists is we look at tissue down the microscope, which enables us to see the cells that the tissue is made out of. What we can then do is we can then look to see if there's any changes in the cells that suggests that there might be a disease process going on. We can then ideally diagnose that disease, let the medical team know exactly what's going on and what treatments might help that patient.
Thank you. And I guess the other question I've been wanting to ask you is, do you need to add colour to cells?
Absolutely, definitely. Technically, a lot of cells are colourless and see-through. So adding the colour not only allows us to see the cells, but it also highlights all the different parts of the cells so we can see how they're working. We use lots of different stains and different colours as they show different things. The commonest stains that we use is hematoxylin and eosin, or what we call H&E. Eosin stains things like red blood cells and cytoplasm and cell membranes red, and hematoxylin stains the nucleus of the cell blue, and together the cell looks overall pink but with a visible purple nucleus, and that kind of lets us see how the cell is working and what's going on there. And we've also got stains that look for things like bacteria and fungi, fats, and even things like elastic fibers in blood vessels as well.
So actually the sort of colouring in that we're going to be doing is actually really, really appropriate, isn't it? That's sort of what you do in a sense.
Pretty much, yeah.
And do you find yourself looking and going, oh, they're actually really beautiful?
Absolutely. You will not meet a pathologist that doesn't have a favourite appearance of a certain disease, which sounds a bit wrong, but some of them are really pretty.
Oh, thank you so much. Thank you for telling us about your work. Thank you.